Hi, thanks so much for joining me today. I want to talk to you a little bit about inflammation because this is so huge to our overall health and wellness and impacts chronic disease as well. And so today we're going to talk a little bit about that and what is that, so you guys have a better understanding of what we are focused on when I talk about gut health and anti-inflammatory nutrition. My name is Linnea Baker. I am a board-certified family nurse practitioner. I am a health coach. I am an Arbonne independent consultant, and I'm a trainer for Rewind Fitness. Thanks so much for joining me. I'm grateful for you guys. So what is inflammation? Inflammation is our body's first line of defense against an irritant. So you may be saying, well, what do you mean an irritant, Linnea? Well, irritants are pathogens, also known as germs, and they can be in different forms. It could be bacteria, viruses, fungi. We also may have an external injury like a sprained ankle. We may be having an irritant that's coming from chemicals or radiation triggering us. And it can also be from different medical conditions that end in the word itis, I-T-I-S, such as dermatitis is a skin inflammation, otitis media is an ear inflammation, and bronchitis is inflammation of the bronchi. Okay, so these are all different ways that these things are irritants that can trigger our body to go into defense mode, okay? And when inflammation occurs, it's the body's immune system being activated and triggered. And there are two types of inflammation, acute inflammation and chronic inflammation. And it's important to know the difference. When I talk about acute inflammation, that's actually good and beneficial to our bodies and our overall health, because what our body is trying to do is fight infection or speed up the healing process, okay? And it's designed, acute inflammation, to actually protect our bodies. And examples of acute inflammation may be how our body responds when we have a cut or we sprain our ankle, or how it responds when we have the flu or pneumonia. So types of signals from our body that we are having acute inflammation may be pain, warmth, redness, swelling, and/or fever. That doesn't mean you'll have all of these, but you may have some or all. And depending on what's causing it, like a bacterial pneumonia infection, you will need to seek medical care. Whereas if you twist your ankle, and you can apply cold compresses and try to see what happens, to see if you need to go in for x-rays because you're concerned you actually broke it, okay? During acute inflammation, the body's immune system releases WBCs, which are white blood cells. That's part of our immune system. And the white blood cells surround and protect the area where this irritant occurred, such as the site of injury, like the sprained ankle. So that's when you twist your ankle, you think you sprained it, all of a sudden you start seeing swelling, maybe there's, and definitely usually there's pain, and that's your body's inflammatory response, acute inflammation. However, then we have chronic inflammation, okay? And chronic inflammation is a whole other ballgame. It's different because it's actually damaging and attacking our healthy tissues and organs when we have chronic inflammation. And during chronic inflammation, that can last several months to years. When we're under a chronic inflammatory state, it's like our inflammatory system is kicking on higher and lasting a lot longer than it does with that acute inflammation. And chronic inflammation actually is the spark that ignites disease, okay? When we have chronic inflammation, our body's immune system just keeps fighting because it's being signaled that there's an attack or insult on the body. So the immune system starts flooding the problem area with those WBCs, white blood cells, but it's actually attacking those healthy organs and tissues. And when we think of chronic inflammation, think of like a smoldering fire throughout your body. So how do you know if you have chronic inflammation, right? It's great to talk about it, but like, how do you know? I had this going on for years and had no idea that this was happening. And that's why I'm so passionate about educating others on what's going on with our body and how to heal our bodies. So you may have bloating. You may notice your clothes don't fit well. They feel tight. You may be gaining weight or have trouble losing weight. You may have low energy or chronic fatigue, muscle and joint aches or stiffness. Headaches could be occurring. You may have GI issues or stomach issues such as heartburn, acid reflux, constipation, diarrhea, Maybe you have slow digestion or indigestion. Maybe you're experiencing sugar cravings. You might suffer from more frequent illnesses such as colds and flu. And you may also notice that the colds and flu, when you do have them, linger longer after you get them. You may have swelling of the hands and or feet, rashes and redness, puffiness, difficulty sleeping, anxiety, depression, or mood changes. You may be suffering from high cholesterol or elevated blood sugar levels. And this can all come back to inflammation, chronic inflammation. So when we talk about chronic inflammatory signals, we want to think of these symptoms like the check engine light on our car is going off. And when we notice them, we really want to stop and tune into our body. I got really good at ignoring these signals, and it just got worse and worse and became more problematic over time. So by teaching you and educating you on this, I want you to really pay attention to what your body is telling you. Because if we don't listen to our body when it's whispering to us and telling us these things through these little signals that we talked about on the other slide, then our body will eventually scream. And that's what happened to me and so many of the people I work with. So we really want to tune in to these signals so that we can catch things earlier. Because my goal is to prevent and help promote health and prevent chronic illness and improve your quality of life, okay? And to do that, we have to be very aware and in tune with our bodies. So research is now showing us that chronic inflammation does lead to these chronic inflammatory diseases, and that can include these are all the things that the United States, they're the number one causes of illness and disease in the United States and even death. Stroke, chronic respiratory disease, heart disease, cancers, obesity, autoimmune disease. I have an autoimmune disease, diabetes, type 2 diabetes. So just to sum up, I thought this was a great quote, and it came from Harvard Health. Doctors are learning that one of the best ways to reduce inflammation lies not in the medicine cabinet, but in the refrigerator. By following an anti-inflammatory diet, you can fight off inflammation for good. And that is everything that I am educating and teaching you guys when we go on a 30-day healthy living journey. We're focused on anti-inflammatory foods, removing inflammatory triggers, tuning into what serves our body well and what is triggering our body so that we can do a better job of fueling our body with the nutrition it needs and healing our gut. When we heal our gut, we can decrease chronic inflammation and we can improve our overall health and longevity. Okay. Guys, this is not here to replace any medical advice from your personal healthcare provider. Please, they know you best. Follow with your personal healthcare provider for questions for your individual needs. But if you do have something you want to ask me, feel free to reach out to me. I'd be happy to answer and talk with you. Thanks so much for your time. I am so grateful for you guys for listening to me and taking some time out of your day. You guys take care, and I'll talk to you soon.